Throughout the whole seminar, we have a team attentive to the questions that have been sent through the chat. Please send questions at any moment. Thank you for your attention. Ladies and gentlemen, I would like to invite the General Coordinator of Food and Nutrition of the Ministry of Health, Ms. Gisele Bortolini, and Ms. Luizete Bandeira, representative of the Pan American Health Organization, who will launch the policy brief of the network towards the action of dietary guides based on the processing level of foods in America. With the floor, Ms. Giselle.
Olá, bom
Hello.
dia a todas e
Good
todos.
morning to all of you.
Gostaria
First
de
and foremost, I'd like
fazer
to
uma
thank
reiteração de
the
todos os
participation
países.
of all the countries. Yesterday,
Nós tivemos excelentes
we've
debates,
had great debates
as
and,
discussões
well, to continue the discussions that have been held in the in person meeting of
gostaria de
2018.
reforçar
And I'd like
novamente
to
que essa rede,
stress once again that
que é
this
a
network has been created
década de ação
in
da
the scope of the
nutrição,
decade of action of
nove países
for
fazem
nutrition.
parte,
Currently, 9 countries are part of that.
e a nossa ideia a partir de agora é
And
retomar a
my
rede
idea
nesse
is
período
to
de
resume this network,
pandemia,
especially
acabando
with
que
the
o ano de
pandemic. And
2020 nós não
in
tivemos
2020, we
atividades,
didn't have any activities.
e a ideia é que nós possamos
And the
retomar essas
idea
nos próximos 4 anos. Lembrando que o
is
objetivo
to have
é
action in the
fomentar
next 4 years. And the
experiências
objective
e
is to
boas
exchange
práticas baseadas em evidências científicas
experiences and good practice based on
e
scientific
cooperação,
evidences
né? Nós sabemos que são
and mutual
muitos os
collaboration.
desafios, né?
We know there are
E o
many common
compartilhamento das
challenges,
estratégias pode nos
and the
ajudar
sharing of strategies may
nesse
help us
cenário
to
atual que
tackle
nós estamos
this
vivendo.
scenario that we're
E como
living right
país
now.
nos fortalecemos. Foi
And as countries, we
interessante
are being
ver
strengthened together. Yesterday,
recentemente, né,
it
saber
was
que
interesting to
a
know that
Argentina está
Chile, both
vivendo
Chile and
situações
Argentina,
parecidas
they
de
are in a very interesting
reformulação,
phase
né, de revisão dos
of
planos alimentares.
revising
E hoje nós vamos ter a
their
oportunidade de
dietary
saber
guides,
como estão
and we'll have the
os
opportunity
planos
to hear
alimentares
the
dos países
status
da
of
rede.
the other countries in the
Então
network.
também teve ontem nós tivemos debate em
So
relação aos
yesterday we had a debate
ultraprocessados
on the
e
ultra processed
agora
foods, and right
nós vamos
now
apresentar para
we're going
vocês
to
o
show
policy
you
brief
the
dos
policy brief
englobados, né, que é
to
entre os membros
remind
da
you
rede.
that
O
for
primeiro
the people who are
produto
part
acordado,
of the
né,
network, the
em
first product agreed
2018
upon
foi a
back in
elaboração do
2018
policy
was the
brief que
elaboration of a policy
summariza um
brief
pouco, né,
that
de
would
como os países
summarize
estavam
how
nessa
the countries
rede
were at that time
e os pontos focais, né,
and the focal
se
points.
vocês vão lembrar na
Uh,
época nós fizemos um
well,
formulário,
we
né,
had the
validamos as
form,
perguntas com
we
todos os
validated the questions
participantes
with all the member
e
countries,
todos os países, né,
and all
quase todos os países da rede, teve
the
países que
countries of
não
the network,
enviaram as
well,
informações,
there were countries that
enviaram
didn't
as
send the
informações
information.
com
All of them
base nessas
did, and
informações,
based on
PAHO nos
these
apoiou na
pieces
elaboração
of
do
information,
policy
PAHO
brief, que
created this
summariza um
policy
pouco
brief that
o
summarizes a
status,
bit
né, dos
the
planos
status
alimentares
of the
no
dietary
ano de
guides
2018.
in the year
E nós temos
2018. So
alguns
today we're
exemplos
going
que
to
eu
make
gostaria
available
de
this version.
apresentar para vocês,
Luisette is going to present that to
que
you,
é um material
remind you
elaborado
that this is
com a
a
contribuição
material
de todos
elaborated with the
vocês em
contribution of
2018.
all of you
E ao
back in
final de
2018.
tudo,
And at
nós
the end
temos
of
um
the day,
espaço para
we'll have
discutir
a
os
space
próximos
to
passos da
discuss
rede.
the next steps of
E
the
a
network.
ideia, uma das nossas
And
propostas é que nós
one of the
possamos, né,
proposals is
atualizar esse
first to
policy brief,
update this policy
considerando
brief,
que se
considering
realizaram
that,
2 3
well,
anos e que
we've
foi
had 2 or 3 years
atualizado
and many things have
recentemente
happened in
pelos
the countries
participantes.
for us to have new
Então, agora eu passo
versions.
para a Luizete,
So
ela vai
now I pass the
apresentar
floor to Luizette, and she
o
will
resultado
present
final, né,
the
daquilo
final
que
result
nós
of that work carried
fizemos.
out in 2018 and 2019.
Muito obrigada.
Thank you very much. Thank you, Giselle. Well, can you hear me? Well,
Sim, Luísa.
okay. So, as Gisele has brought, this policy brief has been elaborated through the cooperation with the presentations of PAHO, WHO in the countries, and then we have representatives of the Ministry of Health in the countries as well. So I would like to thank this effort, this cooperation, and I'll speak a bit about this document. As Gisele has mentioned, it is a project agreed upon in 2018. These information have been collected from this meeting and throughout 2019. And this document describes key points of the elaboration and implementation steps, as well as the assessment of the dietary guides by the countries, and shows strategies to elaborate the tackling of all different forms of malnutrition. Bear in mind the central role of the food systems, production, how to process it, commercialization, and access to food. So, out of the 9 countries, 8 have attended this call, have heard this call, and I will bring a bit of the content of this policy brief. So it summarizes the characteristics of the countries, what countries have guides towards children, adults, pregnant women, and what is the objective of those guides, and they bring recommendations from those summaries. Bear in mind the objectives of the network to boost guides that would bring the objective of influencing the food environment and the objective of boosting other public policies from those dietary guides. And what approach is used? They use the level of processing of foods as an approach to define the recommendations. And if icons are used, what materials have derived from that. So it brings all those general characteristics and information regarding the process of elaboration, bringing recommendations that are in the scope of the objectives of this network, which are the management of conflicts of interest in the step of elaboration of those guides. So they briefly describe, as it is a summary document, how was the structure in the work group process that in the step of elaboration of the guides in the country how it took place, and a bit of these pieces of information that based on elaboration, the based elaboration, or rather, what are the sources of information that have been used, recommending that to analyze if those sources of information presented conflict of interest, and recommending that in this case to be excluded. Who were the responsible parties for the elaboration of this guide in the countries, and also the forecast and the planning of the government. Those guides are inserted in planning instruments of the government, recommending then that, well, to have more and more visibility in in potentiality of these guides for them to be included in the government plan, such as healthcare and the other plans of the countries. So, bringing this recommendation, many countries do so to have public policies based on those guides, bringing these recommendations and boosting more countries to adopt this practice. So, along general lines, the idea of this launch is to bring the scope of this instrument, and finally, this document highlight that those dietary guides have as in their core the promotion to a healthy diet, and they must consider environmental, economic, and cultural social elements that condition access to food practices, and the consequences of certain consumption patterns. And also, that you foster the elaboration of guides based on foods that incorporate the health objectives and sustainability objectives. This is an important step to show the commitment of countries with a sustainable and healthy future. Soon, the policy briefs in Portuguese, Spanish, and English will be made available in the PAHO repository. We'll share the link as soon as they are there. They're in the list to be uploaded. We're just awaiting that. And soon you receive this link to access this document and contribute to your work in the scope of the countries. The MC, you have your mic off. Apologize, Dr. Lizette, Dr. Giselle. Congratulations for your contribution in this very beginning of our seminar. Uh, would like to invite Dr. Inês Rugani, professor and coordinator of the Public Policies and Feeding Program of the University of Rio de Janeiro. She has acted in the coordination of this dietary guide for Brazilian children below 2 years of age and will share more information on this guide this morning. With the floor, Dr. Inês. Thank you very much. I will share my screen with you. I believe you can see that. Gisele has talked a bit about this guide yesterday, and I'd like to thank Giselle for an invitation for being to be here, bringing some reflections on this dietary guide for children below 2 years of age, and the opportunity of the launch of this English version of the dietary guidelines. Well, we hope we can make this version in Spanish available. Now we have the one in Portuguese that was launched in 2019 and the English version that just came out. This process of elaboration came from a very large collective work with these people here. And so this path went from 2015 to 2019 and ended with the breastfeeding program with the World Breastfeeding Conference in Brazil. And I just like to highlight out of this path with the different opportunities that we had to hear the social stakeholders in the public consultation that took place after the elaboration of this document and the existence of a political monitoring policy monitoring group that allowed the transparency of this process. This whole path is described in a specific section of this in this guideline at the end of the document. Well, Gisele requested me to bring some reflections upon the innovative aspects of our document. And the first thing is also bringing back information that Giselle mentioned, are the principles of the guide and the implication of such principles to the document. The principles are these ones that you have here, and the idea was for us to to do so and how to materialize those principles in the messages, in the guidelines and recommendations that would establish. So to say feeding is a social practice, bringing implication on how to we see feeding in the daily lives of families, and that's the way we found coherence throughout the whole path. The guideline towards family connected with their reality, the languages towards the families, and the fundamental idea that first to promote autonomy and empowerment, we need to provide reliable information to families and accessible information in terms of comprehension. So the language was created to be well understood. It has a lot of images that help uh, to understand the recommendations that we're bringing. A fundamental characteristics is the alignment to the guide for the Brazilian population and the NOVA classification that guides the core guidelines. And another thing important is the importance of breastfeeding and complementary feeding in the same document. It feels well, it's obvious, but it doesn't happen all the time. Sometimes we have even in the very WHO we have recommendation for breastfeeding separate from the complementary feeding, and we thought it was important to talk about the first 2 years of children's feeding as well as breastfeeding in the same document. And the other point is to bring through perspective the readiness of the child to towards food, the feeding itself, everything that involves that, and the fostering out feeding and the importance of protection of this child development period with regards to threats to the good quality of feeding, especially advertisement and ultra processed foods. An important message is the feeding of the child is the feeding of the family. If the family feeds well, we don't need separate food. Everything with the idea of facilitating the daily lives of families and integrate this child to the family. The responsive feeding permeates the whole document, and we have clear messages and key messages on that. So, in this, and there's an important space to see the moment of the meal to be an affectionate moment and we work with a communication strategy that it seems but it's not. So basically, to tell the family about foods that are seen as children foods, but they are ultra processed foods, so they're not recommended. So it looks like fruit, but it's not. Looks like cereal, but it's not. This is a resource that was very valued by the people who are working with this material in the daily lives of the families. And there are two sections for partially breastfed and not breastfed, and it was important to have that on the guide. And it's thought it was important to see that because part of our population live in this type of situation, and when all the families who want families who had families that way should be seen that. And we see culinary skills beyond the skills. And throughout the guide, there is a concept of a culinary autonomy, and we go beyond this culinary skills. So there's a whole chapter towards that, and we approach the task, the vision, and we focused on the gender issue and all the discussion on how is this sharing of activities. And there is a chapter towards the challenges, the daily challenges, together with the barriers. And here we talk about the entrance of the child in the daycare center, the mothers returning to work, and many other aspects that permeate the daily lives and a critical moment of keeping an adequate and healthy food habit. And there's a chapter to the legal framework for children's feeding that protects and the idea of supplying, providing families with awareness of these rights guaranteed by law, and then to allow them to exercise the these exercises, 12 steps, and the key messages are here systematized. I won't read them all. I just wanted to highlight that we have one specifically for breastfeeding, two to on dedicated to what to offer in natural food and consistent food from the very beginning, a message that values water and disencouraged even the use of juices, and a clear message on not to offer sugar nor sugary products, and two messages for the organization of the daily lives and preparation of the food and hygiene, and two messages dedicated to this interface with the development of the child and responsive and also the protection of the child being uh, feeding away from home, and as well as advertisement of food.
mensagens, né? Essa ideia, esse reconhecimento, a importância de a gente reconhecer que a alimentação saudável nos primeiros anos de vida, ela é muito estratégica para sistemas alimentares saudáveis e
This is
sustentáveis.
very strategic for sustainable foods and the importance of a specific dietary guides for this group due to the specificity and importance of the 2 days, the two first years for their lives.
And we understand that these guides for children under 2 contributes to qualify the debate on child foods and nutrition. Okay, we invite you to get to know our guide to children, which we call informally. So, Dr. Inez, thank you.